You may have heard the phrase that it needs to get worse before it gets better. But to be honest, in most modern psychological therapy, that isn't true. So the question is, how do you know if therapy is working or not, if it's effective for you? Hi, I'm Noel. My mission is to give you the psychological tools to understand yourself, to understand other people in your life, and to live a healthier and a happier life. Can therapy make things worse? What to expect and what can happen? Okay, so the first thing to say is therapy isn't just one thing. Some applications or some modalities of therapy, the clinician will tell you in advance that you may get some uncomfortable symptoms, and that's fine. So a good example would be EMDR, which is a trauma therapy. The therapist might actively ask you to do things that you don't want to do, such as remember difficult events in between sessions. And that's to check if you've learned the lessons in the therapy about how to manage those symptoms more effectively. So that's not necessarily things are getting worse, but you're being asked to do something uncomfortable. In general, things don't need to get worse to get better. That's very much, I would say, a red flag these days, and an old form of therapy that isn't true. But that isn't to say that you won't be asked to do things that are difficult, because a lot of our psychological defenses are about avoiding things that we find uncomfortable or unhelpful defense mechanisms around our depression, which make us avoid people or activities that make us better. So it won't necessarily get worse, but you will be asked to do things that you think, I don't know if I'm ready to do that, and that's okay. If you like this video, please don't forget to like, comment, and subscribe. It really helps me a lot, folks.